WPLG 715, Fireman Kenny's on the air, helping you to stay safe in a world where danger never takes a vacation. On this episode of the Fireman Kenny Show podcast, we talk with Froedtert and the Medical College of Wisconsin diabetes educator Linda Berger about National Diabetes Awareness Month. Welcome back to all 13 of our loyal listeners to another installment of the Fireman Kenny Show. Be sure to like, follow, and subscribe to the Fireman Kenny Show podcast on Spotify, Apple Podcasts, YouTube, or whatever platform you're listening to the show. The American Diabetes Association has declared November as National Diabetes Awareness Month. On this episode, we talk with diabetes educator Linda Berger from Froedtert and the Medical College of Wisconsin West Bend campus about diabetes prevention strategies. Before we begin the podcast, we would like to mention our sponsors. For over a century, the National Fire Sprinkler Association has been advocating for a stronger industry and a safer world by promoting fire sprinklers in model codes and legislation. Their mission is simple: to protect lives and property from fire through the widespread acceptance of the fire sprinkler concept. Be sure to follow the National Fire Sprinkler Association on Facebook, Twitter, and LinkedIn. You can visit the National Fire Sprinkler Association website, www.nfsa.org. We would also like to thank our friends at Fire Suppression Solutions, distributor of fire suppression products for the fire service and for home use. You can follow Fire Suppression Solutions on Facebook, Twitter, LinkedIn, and YouTube. Now a word from Fire Suppression Solutions.
Fire can strike without warning, leaving you with precious little time to react. And if you are not prepared, the damage can be devastating to life and property. In the blink of an eye, your home or business could be on fire, with flames doubling in size every 30 seconds, leaving you helpless and unable to respond. Don't let this nightmare become a reality. That starts with being prepared. Our fire suppression products are designed to equip you with an effective response to any fire emergency, all while limiting additional damage, making you the true first responder, giving you the peace of mind that you have what you need to keep your loved ones and property safe until more help comes. Do you have a plan to respond to a fire emergency at your home or business? Protect your family, pets, and property with the tools from Fire Suppression Solutions. Contact us today and finish putting your plan into effect before it's too late.
For more information on Fire Suppression Solutions products, you can visit firess.us. Welcome back to all 13 of our loyal listeners to another installment of the Fireman Kenny Show podcast. The American Diabetes Association has declared November as Diabetes Awareness Month. With us today is diabetes educator Linda Berger from Froedtert and the Medical College of Wisconsin. Linda, welcome to the show.
Oh, thank you very much. So I'm Linda Berger. I'm a diabetes nurse. I've been with Froedtert and the Medical College of Wisconsin for over 20 years now. I've been a diabetes educator for about 25, close to 30 years. So I'm on my end of my career, but I very much enjoy working with patients with diabetes. A little bit of my education, I went to Alverno College and got my Bachelor's of Science in Nursing. From there, I worked in a hospital setting, worked with patients with diabetes in a hospital setting, and then went to the outpatient side of diabetes, and I've been there ever since.
So before we continue with the podcast, I would like to take this moment to dedicate this episode to the late Rick Jensen. For those of you who were followers of the Fireman Kenny Show when we were on Magnum Media's WIBD 101.3 FM and 1470 AM in West Bend, you were aware that Rick was a lifelong diabetic and often experienced complications from his diabetes that made his life a little more difficult in his later years. Unfortunately, we lost Rick in April of this year from a stroke, which also can be a complication from diabetes. So again, this episode is just dedicated to the memory of Magnum Media's Rick Jensen. So Linda, when we're talking about diabetes, a lot of our listeners may not understand the endocrine system and the pancreas and insulin. Why don't we do an overview of the endocrine system and the pancreas?
So the endocrine system is a system of multiple organs in our body that excrete hormones. Okay, one of those organs is called the pancreas, And inside the pancreas, we will find the hormone insulin. So the endocrine system is made up of, like I said, a lot of organs, hormones like testosterone, estrogen, thyroid, insulin. Those are all hormones that get excreted in our endocrine glands. When the patient goes to see a diabetes specialist, that's why they're called endocrinologists, because they specialize in the endocrine system. A lot of patients don't realize that, and they wonder why are they called that, but that's why. They're called that because they work with the endocrine system of our bodies. Insulin is what's needed to keep a normal level of sugar in our bloodstream, no matter what we eat. No matter if we ate a whole pie, if we ate a whole cake. If our insulin is working like it should, and we have plenty of it, our blood sugars will be fine. The problem comes in is when we don't have insulin in our pancreas. That's where the problems come in. Somebody with type 1 diabetes is actually considered an autoimmune disease. Their body, unfortunately, has destroyed the beta cells in their pancreas that make and release insulin. So those people have to take insulin. So it's an autoimmune disease, which means that they couldn't have given it to themselves, they couldn't have prevented it. There's nothing they could have done. It's one of those things that, like other autoimmune diseases, come about out of no fault of your own, and you couldn't have prevented it. People with type 1 diabetes typically are going to need insulin for the rest of their life, because insulin, like all the other hormones in our body, are required for us to live. We need thyroid hormone, we need estrogen, we need testosterone, we need all these hormones to balance out our life and make us be able to do the things that we do every day. So people with type 1 diabetes have to take insulin. Insulin could be given to them either through injections, or people with type 1 diabetes might be wearing a pump. The benefit of the pump is that it gives them a continuous dosing of insulin that they program into the pump. And it gives them insulin continuously. They don't have to inject it every so often, like people that take injections. So that's basically with type 1 diabetes what that situation is. They still are at risk for developing the complications of diabetes, like we've learned about Rick. But the key to that is actually controlling your diabetes, and we can get to that a little bit later. But let's talk about type 2 diabetes, which is a very different animal than type 1. We find that with type 2 diabetes, there could be a couple things going on, particularly if you have risk factors for developing type 2 diabetes. We know that a genetic predisposition is most of the time there when people are diagnosed with type 2 diabetes. Whether they know that their family members had it or not is really kind of beside the point. There is a lot of genetics with type 2 diabetes. We're also seeing some genetics with type 1, believe it or not, which we never used to see that. I know families where there's multiple siblings with type 1 diabetes. I know of families where the father and the daughter have type 1 diabetes. So it's not so much a genetic with only type 2 anymore. We're actually seeing it with type 1, which is unusual. When I first started teaching, there was never multiple family members with type 1. But getting back to type 2 diabetes, it's genetic. Like I said, it's definitely a genetic component. Not necessarily, though. There's family members or patients that say that they have nobody in their family with diabetes, which could or could not be true. But the problem with that is that the insulin that they do have, which they do have, might either be plenty of it, but it doesn't work, or they just don't have very much. So they got some, so they don't have type 1 diabetes, but they don't have enough to counteract the carbohydrates that they eat, and consequently, their blood sugar goes up.
So, Linda, when I'm teaching my EMT and paramedic students about insulin, you can tell me if I'm right or wrong when I'm teaching this, but let's say the cell itself is a factory, and the cell's fuel source is the sugar, and the sugar is being delivered by a giant dump truck. And we can say that the insulin is basically the garage door opener that allows the garage door to open for the truck to deliver the sugar. Would that be about correct?
That would be absolutely correct. The way I explain to patients, I think of insulin as the key that opens up the door of the cell to let the sugar in. That's where the sugar needs to be, into the cells of your body, not floating around in your bloodstream, because that's what causes the damage. Yes, that's exactly right. So type 2 diabetes is the more common type of diabetes. We see it in families. We see it in certain ethnic groups. We know that people with Hispanic, African American, Asian, a lot of ethnicities actually have a higher risk of developing diabetes and actually at lower thresholds of diabetes. So that's a very common thing we see in certain ethnic groups. The important thing about both of these types of diabetes is they're very controllable. Different ways to control, but yet still controllable. So type 2 diabetes should not control you. You should control it. And that's a very important thing that I'm going to encourage today in what we talk about, because it's not that diabetes takes care of you or that the diabetes did it to you. It's just that you didn't take care of your diabetes. And that's a really important concept to understand. This is a self-controlled, self-managed disease.
And Linda, there's one other type of diabetes that only affects women during pregnancy. Let's talk a little bit about gestational diabetes.
Yes, gestational diabetes is becoming, unfortunately, more and more common. Definitely seeing more women come into my office with gestational diabetes. A lot of it has to do with weight. Going into a pregnancy, if you're overweight, that is a risk factor for developing gestational diabetes. The OB doctors will order a test, usually towards the end of your second trimester, going into your third trimester. They will order a test to see how well. They'll give you a liquid full of X amount of sugar, and then the lab will check your blood sugar every so often, like every half hour to hour. And given what the results are, would indicate whether or not you have gestational diabetes. That's a test that has been done for a couple decades now in hopes of diagnosing women with gestational diabetes. So essentially what happens is the hormones that are greatly elevated in pregnancy, such as estrogen, progesterone, they're extremely elevated in pregnancy. Now, early on in the pregnancy, in the first trimester, they're not really very proactive. They're not very active in the pregnancy. So we don't check in the beginning of the pregnancy. But we do see, as women get into their second trimester, that those hormone levels, the estrogen, progesterone, start to really increase. And it's that increase in those pregnancy hormones that make it difficult for your insulin to work. So that's why we see gestational diabetes, is because those pregnancy hormones are making it difficult for the other hormone, your insulin, to work. So it's a test that women get because you can't look at a woman to know if she's got gestational diabetes. And so all women are tested to see if they have it. Part of my kind of angst with that is that they only test it once. And I wish that they would test it more often, especially if you're a woman that has multiple risk factors for diabetes. Because the problem is if you're not diagnosed and you don't treat gestational diabetes, you tend to have a lot of complications with that baby. And so we want to prevent that. One of the big ones is you end up having a big baby. A large for gestation age baby would be a baby over 9 pounds. And that's a sign that the woman may have had gestational diabetes in her pregnancy, and maybe it wasn't caught. Now, it wasn't caught because perhaps when she did the test, it turned out okay. But maybe if they had waited a week or two later, she wouldn't have passed it. So it's not a perfect science, just like really nothing else in our world. But we do catch a lot of women with gestational diabetes, and we do work with those women to make changes in their diet. And that many times is all that's needed to keep that baby's weight down and keep the mom healthy through the rest of her pregnancy.
So, Linda, the American Diabetes Association has a number of warning signs and symptoms on their website about diabetes. Why don't we go over some of those warning signs and symptoms?
Sure, that sounds great. But first of all, I want to tell you that the most important thing to take the message to take away today is to know that most people, and that's most people, are not going to have any symptoms that they have diabetes. If you do any research, you'll find that people have diabetes for 5 to 10 years before they're even diagnosed with diabetes. And that's a staggering, sober effect to know that we see people that are already developing complications of a disease they didn't even know they had. That's the downfall of diabetes, is that especially with type 2 diabetes. You typically have no signs or symptoms. Now, we will talk about some of the common symptoms that people do have, but those symptoms only come when the blood sugars are like 300, 400, 500. Then they get these symptoms. But when their sugar is just slightly elevated, they will have absolutely no sign or symptom whatsoever. So when we look at the common symptoms of diabetes, we see things that everybody gets. Everybody gets thirsty. Everybody gets hungry. Everybody gets tired from time to time. Everybody gets blurry vision, okay, from time to time. So again, even if you look at the symptoms, you may think, well, geez, I get those. Maybe I have diabetes. No, not necessarily, okay? So these symptoms can come on very mildly. Sometimes they kind of hit you in the face and then you find out there is something wrong, that you do have diabetes. But more times than not, these symptoms come on so gradual that you don't even realize how tired you feel. You don't even realize that you've been drinking as much as you have. You just don't. It comes on so gradual that it doesn't alert you that there's something wrong. Again, the blurry vision, as we age, all of our vision changes. You may not think anything of it, but yet an eye doctor could look in your eyes and he actually could see that there's some changes going on in your vision that could be related to diabetes. And that's actually sometimes how it's caught. It's a very insidious disease, type 2. With type 1, it's very usually obvious. You're losing weight. You're not trying to. You may have some stomach pain. You may just feel lousy. You may have no energy. You may be drinking water. You can't even stop drinking water. Like you still feel so thirsty. So the symptoms are much more pronounced when you have type 1 diabetes. But with type 2, you could walk around with it for years and have absolutely no idea that you have it. Some people get tingling, pain, or numbness in their feet. That's usually not a typical early onset symptom of diabetes. That's usually over a long time of having diabetes. But again, it doesn't mean you can't. It just means we don't tend to see it as often as we do some of these other things, or that you have no symptoms at all. So that's why it's very important that if you are at risk for developing diabetes, and I believe we're going to be talking about that down the road here in our talk, if you have risk factors, please, please, please ask your doctor to order some lab work, maybe a fasting blood sugar, maybe a hemoglobin A1C, to make sure you don't have diabetes. It's a very simple blood test that can give you the diagnosis. You don't have to fast for it. It's very simple, very easy to know if you have diabetes or you have what's called pre-diabetes, like we used to call it borderline. In my diabetes world, we hate the word borderline. We don't call it anymore. We call it pre-diabetes. And we don't like that naughty word anymore because years ago, doctors would tell patients they had borderline diabetes, just watch your sugars. Well, it's so much more than that. So we try to get away from that borderline diabetes diagnosis, and you either do not have diabetes, you have pre-diabetes, or you have diabetes. So we try to keep those three things and not put that borderline word in there because it kind of made it seem like it wasn't that big of a deal, that you don't have to do much. And that's really not the case. I believe we'll be talking about pre-diabetes, where it's definitely on the rise. If we can diagnose people with pre-diabetes, you can get some education on how to prevent it from turning into diabetes. That's really super important that you get checked, especially if you are at risk for it.
Yeah, Linda, we'll be talking about the prevention activities after we go into statistics, because as all of our community risk reduction people know, the statistics are important because we need a baseline in order to determine our problems and then come up with solutions to those problems and then analyze that data afterwards. So why don't we talk about some of the statistics on diabetes from the American Diabetes Association?
We know the prevalence of particularly type 2 diabetes is definitely on the rise. Type 1 diabetes is on the rise. Gestational diabetes is on the rise. All of those are directly on the rise, definitely. We know that in 2021, there was 38.4 million Americans, and that rounds to about 12% of the population having diabetes, which is very scary. We need to try to turn those numbers around. We know that 2 million Americans have type 1 diabetes, and that includes both children, adolescents, adults can develop type 1 diabetes. So it's not just a children's disease anymore. I see lots of adults, may they be in their 30s, 40s, 50s, 60s, 70s, developing type 1 diabetes. It's not just a young person's disease anymore. Diagnosed or undiagnosed, we know that 38.4 million adults have diabetes, and it's either not diagnosed or it's undiagnosed. With the diagnosed, we know that there's almost 30 million people with diagnosed diabetes in this country. We know that 8.7 million people have undiagnosed, which means they're walking around with it, 8.7 million, and don't even know they have it. That is scary, folks. That's scary. We know that the risk as you age increases of developing diabetes. The percentage of Americans in retirement age from 65 on up still remains high at almost 30%, or 16.5 million seniors. And that's whether they're diagnosed or undiagnosed. That's a very high percentage of just people 65 and older. So it's something that we need to certainly be aware of and get tested. We see new cases of diabetes on a daily basis. I saw one statistic at some point that every 5 minutes there's somebody diagnosed with diabetes in this country. But we do know for sure that there's 1.2 million Americans that are diagnosed with diabetes every year. That number has increased since I've been a diabetes educator. We know that prediabetes has also increased. We know that in 2021, that almost 100 million Americans, so 97.6 million Americans, adults, age 18 or older, have already pre-diabetes. So they're well on their way of developing diabetes if they don't turn their pre-diabetes around to back to normal numbers.
So, Linda, you had made mention while we were talking about these statistics about how your time as a diabetic educator that these numbers have gone up. So is it partially a lesser healthy lifestyle? Is it some of the environmental factors? Or is it better diagnosing of the issues that are being found because of technology and people seeking out their doctors that are causing the numbers to actually go up?
Well, I think there's definitely all of that included. Just in my own lifetime, I would say that our lifestyle as Americans has drastically changed. I remember as a kid, we played outside. My mom washed her clothes with a washer wringer, hung her clothes outside. You did more walking. You rode your bike more. There was just a lot more activity years ago than there is today. The wonderfulness about technology is great. So we have everything at our fingertips. But the downside of that is that essentially we don't even need to leave the couch anymore. There's no need to get up to go do something. There's no need to go to the store. We can order everything. It comes right to our home. And the sad part of that is that with lower amounts of activity, we're seeing higher risks of overweight, obesity, the need for weight loss surgeries, medications for weight loss. All this is directly related to our lack of activity as a society, and certainly food has made a big difference as well. There was no of these coffee shops like there is today. What's in those places is not just our black coffee. It's all the sugary drinks that's in those places. And that is contributing to, I believe, diabetes. Because all this sugary that we're drinking, all this food that we're eating with sugar, is certainly not helping our waistlines. And I see it every single day. And there's 20 cars in line in the drive-thru. It's a problem. It's a problem. And we're seeing kids. More kids are developing type 2 diabetes because they're overweight. They're overweight as a child. And when I was a kid, there wasn't hardly anybody overweight. Everybody was skinny. And the problem with that is that they're going to develop diabetes just that much sooner because now they're starting out in life heavier than they should be and using up more and more of their own insulin to the point that they're going to develop diabetes at a younger and younger age. I've seen as young as 18 years old with type 2 diabetes. And I know over at Children's Hospital, they see a lot younger, as young as 6, 8 years old with type 2 diabetes. And a lot of that has to do with their weight. So parents out there, You need to work with your kids, get them more active, eat healthier foods, sit down at the table together, eat healthy foods. That is so vitally important.
So, Linda, you're making a really great point about the sugary drinks and the sugary coffees, and you wanted to go back to talk about the food, including, like, let's say, high fructose corn syrup and anything else that's put in the food. Why don't we have a more discussion on what's in the food?
Absolutely. High fructose corn syrup we know that is awful, 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 awful. And we see that in our potato chips. We see that in our bakery. We see that when we buy microwave popcorn. We see that in so many foods. You know, it really boils down to healthy eating. And when I mean about healthy eating, I'm talking about getting back to the fruits and vegetables, the proteins, meat, cheese, eggs, fish. Very important that we try to fill our stomachs more with those foods rather than all the buns, the rolls, the crackers, the chips. All that kind of stuff is really very high in not only high fructose corn syrup, but sodium and fat, and that all leads to lots of other problems. One thing I didn't mention that I want to make sure that I mention today too is that along with diabetes, we see a lot of people with high blood pressure or hypertension, as well as hypercholesterolemia, which means high cholesterol. I think of them as the three musketeers. I think of high sugar, high blood pressure, and high cholesterol. The three kind of go hand in hand in hand. And when one person has one, many times they develop the other two. So I just wanted to make sure I said that. But getting back to food, very, very important. I certainly myself try to eat vegetables every day. If I don't like a certain vegetable, then I won't eat it. But I really try to focus on eating lots of vegetables, whether they're raw or cooked, whether I get them frozen in the freezer or I buy them fresh. I try to stay away from canned vegetables. They tend to be more higher in salt. I suppose you could rinse them off too from the salt, but I really try to encourage people to eat more vegetables, and fruit is very healthy for you. Now, fruit is considered a carbohydrate, which does raise your blood sugar, but as long as you're eating a normal portion, there's absolutely nothing wrong with eating fruit. Certainly bread and cereal and things like that certainly do have a place, but I would try to just watch your portions on those. Try to minimize how much you have of them, because that's kind of where this diabetes is coming from, is a lot of carbs that we're eating. And not that corn is bad for you, not that bread is bad for you, but it's when you put together a meal that's all carb, then what happens is that your poor insulin has to be able to handle all that carb. And if you have diabetes, your insulin may not be able to handle all that carb, and that's where people get into problems with their blood sugars going up. We know that proteins don't typically raise your blood sugar very much at all. So whether you have a piece of salmon, whether you have tuna in a can, whether you have a steak, whether you have a chicken breast, whatever it might be, cheese or eggs, certainly try to eat more of those leaner proteins, and again, more vegetables is really what we encourage people to do with diabetes, and also trying to prevent developing it.
So, Linda, even moving on with the statistics, the American Diabetes Association has the statistics on deaths when it comes to diabetes. Why don't we talk about that?
So we know that diabetes is considered the 8th leading cause of death in the United States. That was figured out in 2021. And it was based on 103,000 plus death certificates which had diabetes as the underlying cause of death. Also in 2021, the studies that they did show that diabetes was mentioned as the cause of death in a total of almost 400,000 death certificates.
So, Linda, one of the final things that we usually talk about is the economic costs of diabetes, and the American Diabetes Association has a number of costs of diabetes. Let's talk about some of those costs.
Sounds good. So the cost of diabetes, this was updated November 2nd of 2023, so a couple years ago. $413 billion. Total cost of diagnosed diabetes in the United States back in 2022, which is astronomical, right? $336 billion was for direct medical costs. We found out that $106 billion was an indirect cost to our health system. After adjusting for population age and sex differences, the average medical expenditures among people with diagnosed diabetes was 2.6 times higher than what expenditures would be if that person did not have diabetes. So as you can see, diabetes is very costly. We look at how much we pay for health insurance. It's a growing problem that we definitely need to take a look at and see what we can do to change it.
So, Linda, most of our listeners are looking for the prevention tips, and especially when they're going out in the public and doing their presentations on diabetes and helping to solve the problems of diabetes in the U.S. What are some prevention tips to prevent diabetes?
Oh, awesome. Yes, absolutely. We want to try to prevent this disease. Biggest one, lifestyle changes. Again, let's move more. Let's be more active. Let's go on hikes. Let's go on bike rides. Let's be more active. Looking at what you're eating. Try to have healthier foods. Again, going out to fast food restaurants once in a while is perfectly fine. Should it be done every day? No. Okay? So again, those are lifestyle changes that we need to incorporate. Obesity, that's probably one of the biggest risk factors for developing diabetes is your weight, how much excess weight you carry on your body. If you can lose even 10% of that, that will make a big difference. So it's not that you have to drop 50, 60, 70 pounds, though you may want to. That's not necessarily what's needed. A lot of studies have shown 7 to 10% loss of your body weight really can make a big difference in whether you'll develop diabetes or not. So something to consider. We know that people that smoke have higher risks of developing diabetes. We know that. And so certainly trying to encourage people to quit smoking is super, super important. We didn't know that 20, 30 years ago when that was kind of the mainstay. What most people did was smoke. I know in my mom's generation, that was what everybody did. They smoked, just like everybody's got a cell phone today. But unfortunately, we're learning more and more about the dangers of smoking, and we know that that increases your risk of developing diabetes.
So, Linda, when we're talking about smoking, so we knew that smoking, whether it's cigarettes, cigars, pipes, or whatever, is a helpful cause of diabetes, making diabetes worse. What about vaping? Is there anything involved in vaping that can assist with diabetes since that's in a smoking category?
Absolutely. I haven't done a lot of research with vaping, to be completely honest with you. I guess if I had to take a stab at it, I would say that that's probably not any better than smoking cigarettes. In fact, there's been some studies have shown that its effects are worse than cigarette smoking. So I guess I would go on the side of caution, and I would say vaping is probably worse than smoking cigarettes as far as your risk of developing diabetes. Keeping your blood pressure down. As I mentioned earlier, the Three Musketeers, keeping your blood pressure down, also keeping your cholesterol down, which again, those can be brought down with weight loss, with medications, changes in your lifestyle, quit smoking, can all help lower all those things and try to keep you healthier in the long run.
So, Linda, this has been a really great discussion on diabetes. I thought I knew a lot about diabetes, but I actually learned something in this interview. So do you have any final thoughts for our 13 loyal listeners?
I think the take-home message that I like to tell my patients is taking control of your health. That's a very important thing. That you know what your family history is, you know your own lifestyle, how healthy it is. Try to change it around, try to be healthy, try to eat healthy, try to be active. If you can do those few things, I think you're going to live a much healthier life. And so I would encourage that. If you're at risk for developing diabetes, by gosh, get tested. Get tested. Because you feel okay does not mean that you don't have diabetes. Definitely get tested. Okay? Because how you feel, as you've just learned from me, that doesn't mean anything. You could feel perfectly fine and yet have diabetes. So definitely get tested. Talk to your doctor. Say, I'm concerned about this. And your doctor should order that A1C test or a blood sugar test to make sure that you don't have diabetes. And if you do have diabetes, please take good care of it. If you're struggling, please come see somebody like myself, a diabetes educator or a dietitian. We're only here to help you. We're not here to yell at you. We're not here to judge you. We're just here to help you get your health as good as it can be. And thank you very much.
We would like to thank Linda Berger for the information about diabetes awareness. For more information on National Diabetes Awareness Month, you can visit the American Diabetes Association website, diabetes.org. Join us on our next episode when we talk with Vince Rachopo about Older Driver Safety Awareness Month. WPLG 715, Fireman Kenny is returning to quarters.
They answer the call to be there for you whenever needed. Horwath Family Builders proudly salutes our first responders. Here's another important message on Milwaukee's Hometown Rock.
I'm Captain John Magnus from the Racine Fire Department. A deep-fried turkey makes a delicious meal around the holidays. However, turkey fryers can be dangerous and cause fires and severe burns. The National Fire Protection Association discourages the use of outdoor gas-fueled turkey fryers that immerse the turkey in hot oil. If you are going to use a turkey fryer, be sure to use the turkey fryer outdoors. Never use a turkey fryer inside a garage or other structure. Don't overfill the pot with oil, as overflowing oil can start on fire. And make sure someone is watching the turkey fryer while it is in use. Following these safety tips will help you safely enjoy your deep-fried turkey this holiday season.
96.5 WKLH and Horwath Family Builders are proud to salute our first responders. Get more information and links to first responders throughout Southeast Wisconsin online now at WKLH.com.